the Secretary to the Government of the Federation, honorable ministers here present, directors general, ladies and gentlemen. Much of what I will say is what will be familiar, but it is important to say them every time so that there is no chance of forgetting and there is the best chance of imbibing, and also because it gives opportunity to leave out rumors and false stories. As of today, the 16th of April 2020, a total of 407 people have been confirmed to have COVID-19 infection. And 99 persons have so far been discharged, and 12 deaths are on record as of this morning's record. As you know, it is updated every evening, and most of them with comorbidities. 34 new cases, quite high, and they are confirmed to be distributed as follows: 18 in Lagos, 12 in Kano, 2 in Katsina, 1 each in Delta and Niger states. Unfortunately, one fatality has been a medical professional, and I wish to here express my condolence to the family and to the community he came from. But it also highlights the risk to health workers in the COVID-19 response. Patients with mild symptoms are still very highly infectious, and mild symptoms in one person could be a deadly infection in another person. That is why we recommend suspending close relations between grandchildren who may have no or mild symptoms from grandparents whose responses may not be so strong and where the infection can be more serious. Our valuable health workers are urged to adhere to all government instructions and regulations, to always utilize personal protective equipment as the situation demands, to maintain a high index of suspicion for COVID-19 infection, and to protect themselves, their loved ones, and their colleagues. I use this opportunity to again strongly advise my colleagues in medical profession against secretly or privately managing people who have COVID-19 infection outside of accredited health facilities. We cannot afford to have avoidable morbidity and mortality. Private facilities must obtain accreditation in order to be allowed to treat this highly infectious disease. Practitioners engaging in unauthorized treatment of COVID-19 run the risk of being shut down, their hospitals being shut down for decontamination. This next phase of our strategy in the health sector, due to the available evidence of increasing community transmission in Nigeria, now focuses on community response rather than individual travelers and their contacts in society. There will be more community testing, social mobilization at the grassroots to ensure physical distancing, and advisories on the use of masks or improvised face coverings like handkerchiefs or scarves over the mouth and nose to reduce risk of transmission. Once again, the revised case definition for testing includes all patients with acute respiratory distress syndrome, contacts of persons confirmed to have COVID-19 with fever or respiratory tract symptoms, persons with fever, respiratory tract symptoms of unknown cause, and also persons who are in a cluster where there are many such infections. Despite being the epicenter of the COVID-19 outbreak in Nigeria, the response in Lagos and Federal Capital Territory is commendable as they strive to enhance case finding by conducting house-to-house and cluster testing based on epidemiological assessments. Our ability to do this strategic scale-up of testing over the next 2 weeks will go a long way in promoting detection promptly, testing, and treating people with COVID-19. The national testing capacity shall scale up to 3,000 per day in 13 molecular laboratories nationwide, as activated by the Nigeria Center for Disease Control. The target this week is to significantly increase the national testing capacity further. More laboratories are scheduled to come online in Borno and Sokoto states. States have been supplied sample collection kits and are encouraged to develop innovative methods to improve testing capacity, such as engaging private sector providers to outsource and diversify sample collection sites and improve logistic support. Citizens still have a major role to play by taking social responsibility through adherence to the lockdown measures and regulations instituted by government. The number of persons cured is increasing, and COVID-19 outbreak seems to have provoked some social stigma and rejection of anyone thought to have been in contact with the virus, as well as their caregivers, family, friends, and communities who may be stereotyped or discriminated against. This is not necessary, because stigma can prompt social isolation of persons or groups and drive people to hide their illness, and also prevent them from seeking health care immediately. This could cause a situation where the virus is more likely to spread and increase the difficulty of controlling the outbreak response. So we did not stigmatize persons who have recovered from COVID-19 or even those who just barely tested for it. Having said that, I want to strongly advise that persons who test positive for COVID-19 enter into accredited isolation and treatment centers for proper management. This not only gives them the best prospect of survival and recovery, but protects their family, friends, domestic and office staff, and their community they live in from infection. If not, it will be counterproductive. We have developed various isolation and treatment facilities to meet all needs and expectations of security, privacy, and comfort. And I therefore urge citizens to cooperate with case managers. The fight against COVID-19 is like climbing a steep hill where we cannot yet see the summit. It is hard, persistent work. We must persevere together to succeed. The whole country is in this together, the same with the global community. I urge you all to stay at home, stay safe, except you really must go out. And if you do that, remember the advisory for hygiene, respiratory hygiene, and also social distancing, and the use of sanitizers and a mask, especially including improvised masks especially if you know you will encounter a crowd or find yourself in a public transport or any other place where people have gathered. Thank you. I shall now invite the Director of NCDC to speak.